Welcome to this guide on stem cell transplantation, a life-saving treatment that offers hopes for patients facing various serious medical conditions. Stem cell transplants are used to replace damaged or diseased bone marrow with healthy stem cells, allowing the body to produce new blood cells and restore the immune system. This procedure is often recommended for patients with blood cancer, such as leukemia and lymphoma, bone marrow disorder like aplastic anemia, or certain inherited conditions such as sickle cell disease. In this video, we will take you through the entire journey of a stem cell transplant, helping you understand the process, the preparation, and what to expect every step of the way. Let's get started. The first step in the journey to a stem cell transplant begins with confirming the diagnosis. The haematologist will review all investigation reports in details with the patients and their family. This includes discussing blood test results, bone marrow reports, and other necessary evaluations. It is an opportunity to ask questions and gain a clear understanding of the path forward. The process of a stem cell transplant involves several key steps. It begins with induction chemotherapy, a treatment designed to lower blood cells in the bone marrow and achieve remission. This prepares the body for the next stages. Next is stem cell harvest, where healthy stem cells are collected either from the patient or a compatible donor. These stem cells will later replace damaged or diseased cells. Following this is conditioning, a phase involving high-dose chemotherapy and/or radiotherapy to eliminate any remaining abnormal cells and prepare the body to accept the new stem cells. The central step is the stem cell infusion, where the collected stem cells are infused into the patient's bloodstream, allowing them to migrate to the bone marrow and begin the process of producing healthy blood cells. Finally, there is the recovery phase, where the patient is closely monitored as the new stem cells engraft and the immune system begins to rebuild. This period requires careful attention to prevent complications and ensure long-term success. Let's start with stem cell harvesting. This is the process of collecting healthy stem cells. Before the harvest begins, medication called growth factors are often given to stimulate the production of stem cells and move them from the bone marrow into the bloodstream. Once ready, the stem cells are collected using a procedure called apheresis. During apheresis, blood is drawn from a vein and passed through a machine that separates out the stem cells. The remaining blood is then returned to the body. This is a safe and typically painless process that may take a few hours. Once collected, the stem cells are carefully processed and stored until they are needed for the transplant. This vital step ensures the healthy stem cells are ready to help regenerate the patient's blood and immune system. Next, we move to conditioning. Conditioning prepares the body to accept the new stem cells by creating the best possible environment for them to grow and thrive. This process typically involves high-dose chemotherapy for a few days and in some cases include radiotherapy. The goal is to destroy any remaining cancer or abnormal cells to suppress the immune system to prevent it from attacking the transplanted stem cell and to create space in the bone marrow for the new stem cell to engraft. While conditioning can cause side effects such as fatigue, nausea, or low blood counts, these are carefully managed by the medical team. Once conditioning is complete, the body is ready to receive the healthy stem cells. During stem cell infusion, the collected stem cells are infused into the patient's bloodstream through an intravenous line, similar to a blood transfusion. This process is painless and typically takes 1 to 2 hours depending on the volume of stem cells being infused. Once in the bloodstream, the stem cells travel to the bone marrow, where they begin to engraft. Over time, these cells will grow and produce new, healthy blood cells, rebuilding the patient's immune system and restoring normal blood function. During the infusion, the medical team closely monitors the patient for any immediate reaction and ensures comfort throughout the process. The recovery phase of a stem cell transplant is when the new stem cells begin to engraft and produce healthy blood cells. This phase typically spans several weeks to months. During this time, the patient's immune system is rebuilding, making them more vulnerable to infections. Close monitoring in the hospital is essential to manage any complications such as infections, bleeding, or graft versus host disease. Patients may experience fatigue, appetite changes, or other side effects as their body adjusts to the new cells. Supportive care, including medications, transfusions, and nutritional support, is provided to aid recovery. As the stem cells engraft and blood count improve, patients will gradually regain strength and their immune system will start functioning more effectively. Stem cell transplantation is a journey, but with the right support, knowledge, and care, it offers the possibility of a fresh start and a brighter future. Every patient's experience is unique, and our medical team is there every step of the way to guide you through it. We hope this video has helped you understand what to expect during your stem cell transplant journey. If you have any questions or need further information, do not hesitate to reach out to us.